Hello, everyone. I'm going to go over how to chart for your observation classes. This is going to be so you know how to get an A. So I'm going to go with the top-notch information of what you need to get an A in observation class. So first of all, when you're charting the form, you're the observer, and you're going to be watching a practitioner. You're going to be like the fly on the wall. You're not going to ask the patient questions. That's the practitioner's job. You can ask the practitioner away from the patient for more thorough information. So with that being said, let's go ahead and talk about where your points lie with this. So we're going to start over here. This is going to be your extra credit right there. Okay, so for each of these that you fill out, except for your name has to be there. You're the observer. You don't get extra credit for that. This is going to be 0.25 per area that you fill out. So we'll start with today's date, 5/6/24. Practitioner, say Dr. Lisa Anderson. Sorry, limited space there. So our patient, we're going to put the patient's birth sex for extra credit. If we don't have access to this information right here, the height, weight, and if the practitioner doesn't take the blood pressure, to get extra credit, to get credit, you want to write NA. Appointment begin time, let's say it's 11 o'clock a.m. And patient's preferred language, we'll say English. Okay. So now, for what you're actually getting credit for, symptoms. You're going to get 10 points for the symptoms. You want to write 4 or more. It doesn't have to be the chief complaint. It's just listening to the patient. What is the patient saying? Now, they may not cover 4 or more when you're actually observing your practitioner. Maybe there's only 2 that is discussed. I just want you to write a little note that says, only 2 symptoms were discussed. Okay, so, but let's say that there's 4 or more. Let's start with stress. Let's say it's a new job. Let's talk about pain. Let's say left shoulder stabbing. This is acute. Let's say, not acute. Let's say this started, acute. Let's say it started 3 days ago. Number 3, fatigue. Waking at night, can't fall asleep. And let's say number 4, decreased appetite. Three months, started with new job. And this is worse with stress. Okay, so our next section is going to be, so this next section is also 10 points. I would like for you to check every single box, but you at least need 9 or more boxes. So when your practitioner is asking questions, especially when you're observing here in the student clinic, Dragon Rice's clinic, they should be asking these questions right here. Any chills or fever? No. No abnormalities detected. Perspiration. I get night sweats. This is them telling you that's subjective. Thirst, no, my thirst is fine. No abnormalities detected. You must check each of these boxes. Urination, no abnormalities detected. Aches and pains, we talked about the left shoulder pain, having that stabbing pain, right? So we can put C above, but I still want you to check the box, subjective. Respiratory, no, my breathing is fine. But let's say you can actually hear them wheezing. I hear you wheezing a little bit. It's objective. You noted it, correct? Sleep, energy, exercise. Well, we know from the fatigue, lack of sleep. So they already talked about this. But let's say they go into a little more detail. No exercise. Sleep decreased with new project. Reproductive issues, no complaints, no abnormalities detected. Mental, emotional. The patient is expressing anger over this new project. Frustration. Ears, eyes, teeth, and gums. Let's say no abnormalities detected. Appetite, digestion. Let's say that, well, we had from up there. From our main complaint, we already had lack of appetite, right? Decreased appetite. You can write it again. Maybe there's more information. Only craving starches. I don't know, just saying. Palpitations, dizziness, numbness. You ask them and they're like, actually, matter of fact, I am getting palpitations. Right? Easy 10 points right there. Okay, so the next area, and I'll scroll back up, is this right here. This is also 10 points. This is your interpretation or even your notes. So where it says notes right here, you could put something about the patient, treatment work last time. Any sort of information that you want to put as a note is going to count towards your 7 or more interpretations and notes, okay? So I know whenever you're first starting out, you're thinking, well, I'm not sure what I'm doing. I don't know how to interpret these things. Maybe your practitioner can help you out with that, or you can do a little bit of research. Night sweats, let's say that's kidney insufficiency. Okay, wheezing, well, you have a couple of different options. It's going to depend on whether there's inhaling or exhaling. Let's say that there's lung qi deficiency, or could be kidney qi not grasping. Right? Maybe you're not certain. Anger, new project, frustration, liver qi stagnation. Palpitations. Maybe you're not sure, but like, hey, it has something to do with the heart. Okay. So if I scroll back up, is that information still here? Let's see here. Yes. Okay, good. So we can go through also with this pain, stabbing. That's going to be blood stagnation. Fatigue, waking at night, can't fall asleep. Maybe you're not sure. Maybe you're like fatigue, chi deficiency. Maybe you're a little more advanced and you're like heart chi deficiency. Decreased appetite. And we got some spleen chi deficiency here. Worse with stress, again, liver chi stagnation. Okay. If you want to put stress in your job, there's quite a few variations that you could put on there. Maybe the stress is in calm, what we call heart chi agitation. All right, there's your 10 points right there, okay? So far we have 30 points total. So let's get into the backside here, pulse diagnosis. This is also 10 points of your grade. You want to put 5 or more pulse qualities. And also the position if you're upstairs observing in the student clinic. Now, if you're externing and your practitioner does not take the pulse, all you need to do is write NA. Okay, so let's just put some pulse qualities that have to do with our case here. Let's say that our left middle position, which is going to be our liver position, is tense and pounding. Let's say that our left distal position, which is our heart position, let's say that that is diffuse and reduced pound. And let's say from, we also noted in the right middle position, let's say we have reduced pound and reduced substance, deficient qualities. Okay, easy 10 points. And you can get that information after the practitioner has talked with the patient and you're like away from the patient. You can ask, if you can look at the pulse sheet and get that information from them. Okay, here's another 10 points. The tongue. Just as long as you kind of draw and maybe write out a little bit of something, more detailed is best. So let's say you have red at the tip. Let's say you have scallops. Maybe you've noted that there's some lines in the back of the tongue. If you don't know what that is, that's fine, but if you see it, go ahead and draw it. But this would actually be something like kidney insufficiency. And let's say that the overall color of the tongue is pale. The underside of the tongue, let's say that it's distended, meaning that you can actually see the veins. And then maybe you can see a little peachy there too. This information you can actually, now your practitioner should have the tongue written on their form, that you can start noting this information yourself. You can start looking at the tongue and saying, wow, I see cracks. Wow, I see a darker color, a lighter color. I see something weird on the side. I think that's scallops. Whatever it is. Maybe it's pale on the sides, but it's different on the rest of the tongue, etc. You can make those notes and write whatever you want on this, okay? So here's the next section that's 10 points. This is one that a lot of students have the most issues with because depending on where you're at in the Oriental Medical Assessment class, the OMA class, some people have started noting the lines, started noting the colors. The thing is, you don't have to go through those specific classes to be able to start looking for colors yourself. Maybe you're looking at the face and you notice that, wow, like on the edges near the hairline, it looks blue. It's okay, write it down. Maybe you're not certain about the ear, you don't know what it means, but you're looking at the ear. Oh, that's well. This is kind of bad here. There we go. And you're noting that, I don't know, stuff like close to the head, like maybe you notice the whole ear is just like more closer to somebody's head. Maybe you're seeing lines. Oops. Maybe you noted that there's like a red spot right here or here. Maybe you noted there's white right here. Okay? So just anything that you see on a person, maybe their face, their eyes, maybe their eyes are bloodshot. Maybe you've noticed just certain lines running across their eye that's unusual. Also, another thing about the face is you can also look for lines on somebody's face. Even if you haven't gone through the facial diagnosis yet, that's okay. That's okay. Let's say here's their eyes here and then you see a line. I'm okay with that. This is great. This is great that you're being able to note this. Maybe you see lines here. You're not sure what it means yet, but you see them. This is good. Perfect. So you really want to put 5 or more facial, eyes, or ear. You want to put more information, 5 or more like things about the ears, eyes, or face. This little section right here, this is extra credit. This is, I'm only giving 0.25, okay? So if you want to, remember the left shoulder pain? Maybe it's more in the back side, I don't know. Or maybe it is over, let's see here, right there too. So you'd get 0.25 just for that. So anything that you want to note and put in that area, you can. Okay, so here are the remainder 10-point areas. Okay, assessment and diagnosis, 10 points. Treatment principles, 10 points. Plan of treatment, 10 points. This is another one that students have a tendency to get confused on what they're supposed to put in these blocks. So assessment diagnosis, you really want at least 4 of the diagnoses. Okay, so on our front page, we had liver cheese stagnation. I'm just going to abbreviate STAG. Spleen chi deficiency. We had a little bit of heart chi agitation. What else did I have? And kidney deficiency. I'm abbreviating it DEF. So you want the treatment principles to match the assessment diagnosis. So for liver chi stagnation, we want to move liver chi. I said this is information in the beginning when you're like in 101, 102, you'll most likely need to get from your practitioner. Spleen chi deficiency, you want to tonify spleen. Heart chi agitation, calm shin. Let's calm the mind down a little bit. Relax. Kidney yin deficiency, nourish kidney yin. Okay, so these match our diagnoses. Plan of treatment, this is going to be your acupuncture or cupping. There's not any criteria for this. It's just what are the acupuncture points that your practitioner used. Let's say that this practitioner used LA4, well, I guess that would be me, right? And liver 3, let's see, spleen 6, maybe we also have stomach 36 here in the mix. Let's say we have yin tong to help calm the mind. Kidney 6, heart 7. Okay, these don't have to match the treatment principles per se. Okay, you don't need to do it in that way. You can just write them all out. Okay, so there's our other 10 points. The last one is this section right here. This used to be an extra credit section, but since people are doing more and more billing, and also this is good for actually applying information in case, I don't know, your paperwork gets audited or something like that. So for acupuncture, you can put C points above. I was generous and gave some points as long as somebody wrote something here like acupuncture, but you really need to make note of beginning and end time. So let's say that we've done our whole interview with this patient and we're starting at 11:30 a.m. Let's fast forward time. And let's say that we kept them in for 15 minutes, 11:45 a.m. And that's when we, let's see, took out the needles. You can also write cupping. Let's say it's the shoulder, left shoulder. Okay, when did we start this? We started it at 11:45. Oops. We did it for 5 minutes. No, we did it for 10 minutes. Okay, there you go, easy 10 points. All right, the remaining section is going to be extra credit. One second. There we go. There we go, perfect, okay. So the rest of this is extra credit right here, 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 and here. So there may or may not be an herbal formula. If there's not, NA. And then poof, you get 0.25 points. Post-treatment assessment. How did your patient feel afterwards? My patient felt great. Shoulder pain decreased. Decreased to 0. Recommendations. I don't know. Go home and rest your shoulder. Don't overuse it. What did you learn from this case? These last two, they're like easy points. I mean, what did you learn from this case? Maybe you learned nothing, but maybe you learned what blood stagnation was. That word's about blood stagnation. What aspects of the case are you unclear about? Maybe you're not unclear about anything. Go ahead and put NA, and you'll get points for it. Okay. You don't really get any points for this, but this is just good for you to do. Let's say that the appointment ended at 12 o'clock. All right? So that is how to chart with your OBS and OMA classes to get the most optimal points.